What is post-void residual volume for bladder health? Have you ever wondered how much urine is left in your bladder after you think you have finished urinating? This brings us to the concept of post-void residual volume, often abbreviated as PVR. Post-void residual volume refers to the amount of urine that remains in the bladder immediately after urination. Understanding this measurement is crucial for evaluating bladder function and overall bladder health. In healthy adults, the normal post-void residual volume is typically less than 50 milliliters. However, values up to 100 milliliters can be considered acceptable without indicating significant dysfunction. When the residual volume exceeds these levels, it may suggest incomplete bladder emptying. This can be a sign of various underlying issues, such as urinary retention, bladder muscle weakness, or even obstructions in the urinary tract. To measure post-void residual volume, healthcare providers often use diagnostic procedures like bladder ultrasound. This non-invasive test employs sound waves to estimate the urine volume remaining in the bladder. Another method is catheterization, where a thin tube is inserted into the bladder to drain and measure the residual urine. These tests are essential for diagnosing the causes of bladder dysfunction and determining the best course of treatment. From a bladder health perspective, having an elevated post-void residual volume can lead to several complications. It increases the risk of urinary tract infections, bladder overdistension, and potential damage to the bladder muscles. Over time, chronic retention can reduce bladder capacity, leading to symptoms such as frequent urination, urgency, or even incontinence. In the context of bladder cancer, while measuring post-void residual volume does not directly diagnose cancer, abnormal bladder emptying and urinary retention may sometimes be linked to tumors that obstruct urine flow or affect bladder function. Therefore, assessing PVR can be an important part of a broader evaluation when bladder cancer or other serious urinary conditions are suspected. Overall, monitoring post-void residual volume is a valuable tool for maintaining bladder health. It helps detect dysfunction early and prevents complications. If you have concerns about incomplete bladder emptying or any urinary symptoms, it is essential to consult a healthcare professional for proper diagnosis and management.